We're gonna be raffling prizes. Everyone received a blue ticket when they came in today. I have 3 gift cards.
Okay. You have to be in the room to win.
You need to be in the room to win. Ready? I'm gonna do the first one. 7722303. 7722303. Yay! Well then, so do it, George. Do you want me to do one more?
I'll do, yeah. Go ahead and make your announcement.
Hi, everybody. This is Moish Nussbaum from White Glove Consulting. I believe at this point, anyone that was by any of these seminars is aware of what we do. We do Medicaid planning. We help you out with the most complex cases, people being discharged, needing Medicaid. That's what we do. Another thing that we do, besides the raffles right here, there's a bowl right there where you can put in your business cards, and you might be the lucky winner. This time, we upped our game, and we will be raffling out 2 bottles of scotch, a Tomato 16 and the Glenlivet 15. You don't want to miss on that one. You might lose this raffle, I'm sorry to hear, but you might win that one. So, yeah, let me take out the raffle for this one, though. All right. 772-2242.
Want to
Anyone?
repeat that?
Anybody? 772-2242. Oh.
All right, we'll try another one. Oh, anybody? No. Oh, you have a ticket? Oh, yay. Okay. We have a winner. A winner. Come on up. Check you. Oh, great. All right. Very
All right.
good. Thank you. Yeah. Yes, we're going to have our next. Give us a little bit about your business, and please.
Sure. My name is Jason. I represent Wilde1. If you've seen us around the neighborhood and throughout Long Island, we provide a emergency ambulance transportation as well as non-emergency transportation. We have those nice, funky-looking teal blue ambulances out there. Can't miss us. All right. 7722277. All right.
Oh, Ray, we got another winner. All right. We love winners. All right, awesome. Thank you so much.
Hello, I'm Judy from Precision Health. This year we celebrate 35 years in business serving the long-term care community. We provide mobile diagnostics, x-rays, EKGs, sonograms, Holters, pacemakers. We've always been known as the leader in the industry. We now have our own online ordering, and I'd love to come and see you and talk to you about it. I'm right over there. Thank you. Okay, 7722275.
Yay, Gillard, winner. All right, excellent. Thank you so much.
Good morning. Joe Peixoto, Regional Vice President of ProCare Pharmacy. We are a super regional pharmacy. In the United States, we have the national companies, which you know you are. But we have a distinction. We are the largest pharmacy in the Northeast. So we are big enough to compete with the big ones and small enough so that you can know every single name of our employees. And please, if you have any chance, come to our booth and see the difference that we can provide you. Thank you very much. 772-2240.
All right, another winner.
Another one?
All right, thank you. Thank you from ProCare. We appreciate that. And we'll save the grand prize for the end. You will need to put your business card in the bucket there in order to win that. So without further delay, it's our pleasure to introduce our next speakers to you. Many of you are familiar with Eve and Lourdes. Eve Cooper Smith is from Garfunkel Wilde. She's a partner, and you've heard Eve make some comments regarding healthcare law, so we're looking forward to a presentation. We'd like to begin with Lourdes Martinez, who is also a partner at Garfunkel Wilde. So thank you. Please welcome Eve and Lourdes.
Good morning. We're still trying to figure, does it work? No. So, when I sent the slides to Mary, she said, we have to give people some good news. So here's your good news. We're all here, we're alive, we're all healthy. Nobody here has coronavirus so we're doing pretty good. After that, these regulations aren't really a whole lot of good news. But don't shoot the messenger, because I really had nothing to do with them other than sharing what they are. So, can I use this instead? Okay. So, there's a whole bunch of new regulations, and unfortunately, nursing homes are really the big target, which we're going to be talking about later, from the federal government. But let's start with the new regulations from CMS. So CMS now has, CMS, that's the Feds, Center for Medicare and Medicaid Services, they have expanded their authority to revoke or deny enrollment in Medicare, Medicaid, and CHIP. So what's behind this? They came to a realization that there were some not great providers who would shut down and then start anew with a new company. So now they've expanded their authority and they've changed the process and added more questions to what we have to do in order to become Medicare, Medicaid, or CHIP providers. Okay? They actually wrote in the preamble that their attempt here was to prevent the continuing game of whack-a-mole, trying to get the bad providers over and over again. So now, while you are enrolling into Medicare, Medicaid, or CHIP, you must disclose to CMS any current or previous affiliation, and we're going to talk about what an affiliation means, with a provider that has any uncollected debt, and provider they mean individual, that has any uncollected debt, has been or is subject to a payment suspension under a federal health care program, has been excluded, can you hear me? Okay. Has been excluded from Medicare or Medicaid, or has had billing privileges denied either voluntarily or involuntarily. So, if you have a physician, for example, sometimes physicians say, I'm just going to voluntarily leave the Medicare program. That's going to have to be explained if you are trying to get enrolled into Medicare or Medicaid in any kind of business dealings with that particular physician. So, what does an affiliation mean? It means a 5% or greater direct or indirect ownership. Indirect here, I think, being the key word. In an individual or entity that has another organization. 5%, that's a very small percentage. A general or limited partnership interest of any percentage, could be 1%, could be less than 1%, an interest in which an individual or entity exercises operational or managerial control over or directly or indirectly conducts the day-to-day operations, the officer, director of a corporation, or any reassignment relationship. Now, what you will notice is that the 855s, that's the form that we have to fill out, the 855s, sorry. the 855s, they're supposed to be changing the forms in order to capture the answers to these questions. So how are they going to make sure that we do the right thing? So let's go to the next slide, because if we don't answer the 855s correctly, if we don't do it correctly, and we submit false information, then they can bar enrollment for 3 years, okay? Which means you didn't disclose it on the form, I'm not letting you in for 3 years. If they revoke enrollment because we did not disclose on our 855, remember, we have to do these 855s periodically. It's not just a one and done. So if they revoke enrollment, they could block you for 10 years, or if you're revoked twice, for 20 years. So let's go back to the previous one. These are the reasons that they can revoke or deny enrollment. If a provider circumvents program rules by going back into the program or attempting to come back in under a different name, if a provider bills for items or services from a non-compliant location. Now, the 855s have in them already what the location are where you're providing service. So you're going to say, I provide services in A location and B location. If you bill for services provided at C location that wasn't on the 855, they can revoke or deny you. A provider exhibits a pattern or practice of abusive ordering or certifying Medicare Part A or Part B items or drugs, or the provider has an outstanding debt to CMS that has been sent to the Department of the Treasury. So these were effective last November. I'm not going to lie, I didn't check the 855 to see it was already changed, but from November to now, I doubt it. Questions on that? Okay. So, the new public health laws. Most of these come into effect on April 14th of 2020, right before tax day. So these were all signed into law by the governor in December 16th of last year. And at least we're told that it's an attempt to have greater control amongst the nursing home industry and greater transparency. They're kind of onerous. I think that what's triggered this is a lot of sales of nursing homes to for-profit entities, also to out-of-state operators that are coming in and buying nursing homes in New York. And there's also a perception, and I'm not telling you anything that you don't know, but there's a perception that some providers are trying to get the sales through by not being completely honest. So, for example, it was reported that there was one buyer who had a pending violation in his or her nursing home, so they put their manager's name on the application as opposed to themselves so that they can buy nursing home X or the different nursing home. So this allows the Department of Health to more thoroughly go through the owner's records. Now, a lot of the stuff that we're going to talk about is unclear, at least to me. I've looked. There's really no guidance on it yet, but you'll see what I'm talking about in a second. Okay. So this is in the new requirements, okay? A nursing home operator must notify the Department of Health of any common or familial ownership of any corporation, other entity, or individual providing service to the operator of the facility. So if you have another company that your nursing home is using, or your wife, or your son, or your daughter, or your cousin, or whomever, you have to disclose that to the Department of Health. And it's different than the related party transactions that we have to put on our cost report, because this doesn't say that it's only if you pay them. So let's say I owned a nursing home and my son was a doctor and he was the one that did the second floor and he took care of all the residents on the second floor. Potentially, I have to disclose that to the Department of Health, even though my son, in my example, is billing on his own. So when do you have to disclose it? I have no idea. But I do know, there will be a yearly attestation. So every year you will have to attest under penalties of perjury that you have disclosed all familial relationships with whomever it is that you have that's doing work for the nursing home or the operator. Next requirement. An operator is prohibited from entering into any arrangement to guarantee the debt or other obligation of a third party which has not received establishment approval. What does that mean? Well, I'm not sure, but I could tell you what I think it means. I think what they're doing is trying to get the operating company, the operator of the nursing home, to not be able to guarantee the debt or the mortgage of the property company, which are usually two separate companies. One company owns the property, one company owns the nursing home. I think that's what they're getting at. They're prohibiting that. But again, there's been no guidance. Okay. The nursing home operator must notify the Department of Health at least 90 days prior to executing a letter of intent or other contractual agreement related to the sale, mortgaging, encumbrance, or other disposition of the real property. What do I think they're getting at? I think they're getting at, we want to have notice, we the Department of Health, if there's going to be a refinance or some other mortgage. I'm not sure that they get to their intended end because the regulation is against the operator. The operator has to comply. It's not against the property company. It doesn't cover the property company. So I'm not sure they're getting to their, intent the way it's worded. But again, there's going to be a lot more that's going to come out on this in the next month or so. Okay, you must refund to the Department of Health any funds provided for capital investment through Medicaid rate adjustments or otherwise provided by the state for the purpose of improvement of the facility if the facility is sold for a non-healthcare purpose. Again, what's the time frame that you have to pay these monies back? So if you own the nursing home for 20 years, what capital component do we need to pay back? I have no idea, and it is completely unclear. Okay, new reporting requirements, which the good news on these is it's not really new. It's really the state catching up to what the feds had told us we needed to do in 2016. So there's a little bit of good news for you. So what did they do? They defined abuse more broadly, which we've been defining more broadly anyway, because we have to also comply with the federal rules. It's not just physical abuse. They added misappropriation of property, which we've been doing anyway. We've been reporting misappropriations of property. They said that abuse now includes verbal, mental, or sexual. We already knew that. And that we have to have policies and procedures. There's nothing really new other than they're catching up with the feds. It does expand the reporting requirements to not just employees of the nursing home, but contractors. So if I go in and I see an abuse, I'm supposed to report that as well. It directs the department to develop forms. Let's not hold our breath. And this, you have to contact law enforcement if whatever the abuse rises to the level of a crime. So what are they doing? They're just codifying what we already had under the Federal Elder Justice Act. Again, this isn't really anything new. The reports will now be sealed rather than expunged if they're unsubstantiated. They write a lot about that. Okay, so I put this in just because I still think there's some confusion as to the timing of reporting, okay? So the federal government says you must report immediately if there's abuse and serious physical injury. They define immediately as 2 hours. New York State also says immediately, but they don't define it. They don't define what immediate is. So my best recommendation is you got to go with what the feds say. So if the feds say it's 2 hours, then immediately means 2 hours if there's serious physical injury. If there's no serious physical, then you have 24 hours. But remember, and this is confusion I get all the time, we don't have 5 days to report. We're supposed to report as soon as we have reasonable suspicion that something happened, abuse, neglect, mistreatment, misappropriation of property. We're supposed to report immediately. We have 5 days to do the investigation, okay? So I feel like there's still...
The confusion still lies with, we tried to clarify with the Department of Health, which I had shared with you guys, regarding alleged abuse. So alleged abuse was everybody's question, because in the federal guidance it says within 2 hours of alleged abuse. So we tried to clarify it because we were under the impression, because the New York State manual says within 24 hours, right? They said that they're considering taking their manual down while they wait for the federal guidance, but they don't want to take all the other information that people might be accessing. But they clarified that alleged abuse, a credible allegation of abuse, needs to be reported within 2 hours. So I know there's a lot of questions. We put it back on the agenda for April's meeting because people were having trouble with what's a reasonable allegation of abuse. All right, so I think that requires the leadership to review and then to be able to stand behind what they feel the allegation is. But if you can't disprove an allegation that a family member says for a resident, then you would have to call it in and continue your investigation. So they say 2 hours. We haven't seen anybody receive a citation for not doing so. But just to clarify that, because I know it was confusing me for quite some time, so we're still working on that.
So I think from my perspective, and don't go too far, is... to me, it's what rises to the level of reasonable suspicion, right? So if I say to you, Mary, I just saw Eve hit this resident, right? I'm telling you I saw it. You have reasonable suspicion at that point because I'm telling you, I'm your witness. Now, maybe I hate Eve and I just want to do it because I want to get her in trouble or whatever. That'll come out later. But you need to report it, and then when you do the investigation and realize that Eve and I are fighting like cats and dogs, then you could say in your investigation, nothing happened. But you have reasonable suspicion once I tell you I see Eve hit a resident.
Yes. What about if a confused resident tells someone the next day that during the night someone came in her room and slapped her face?
So the question is, what if a